Good morning. It's July 11th, and this is your daily brief in science. Here's everything you need to know. A new autonomous surgical robot, the Surgical Robot Transformer Hierarchical, or SRT-H, has demonstrated notable progress in performing complex procedures with high precision. It responds to voice commands, learns from feedback, and can adapt to unpredictable scenarios during surgery. Currently tested on pig organs and ex vivo models, the robot has not yet been used on live patients. Challenges remain, including miniaturization, managing bleeding, and handling organ movement during real surgeries. Experts emphasize the need for further testing to address variables like tissue differences, patient movement, and bleeding. The tests so far do not account for live tissue complexities, indicating more research is necessary. Medical professionals highlight the importance of rigorous testing and human trials to ensure patient safety before widespread adoption. Dr. Noha Yassin and other experts stress that thorough clinical trials are essential to verify safety and effectiveness. Industry specialists see this as a milestone towards surgical autonomy, potentially enabling surgeons to oversee multiple procedures at once. The global surgical robotics market is approaching $10 billion annually, with millions of procedures performed in 2024, reflecting rapid growth. The development aligns with NHS plans to increase robotic surgery use, aiming for 9 out of 10 keyhole surgeries to be robot-assisted within the next decade. The SRT-H system uses a hierarchical AI framework, with one layer analyzing endoscopic video and issuing instructions, and another translating these into precise 3D movements, allowing it to identify structures and execute steps even amid disruptions. A rare dinosaur fossil has been discovered beneath the Denver Museum of Nature and Science, revealing new insights into the region's prehistoric past. While drilling for geothermal energy, paleontologists uncovered a 67.5 million-year-old vertebra in the Denver Formation, an area known for its rich fossil record. The fossil was found at a depth of approximately 763 feet during core sampling for a project funded by a $250,000 grant from the Colorado Energy Office. This project aimed to explore geothermal energy as a sustainable alternative to natural gas and involved drilling nearly 1,000 feet deep. The fossil, described as hockey puck-shaped, is one of only 2 similar discoveries recorded globally in borehole samples, making it an extraordinary find. The region where it was found once featured tropical swamps and floodplains, offering a glimpse into Denver's ancient environment before the mass extinction event. Researchers described the discovery as nothing short of magical, emphasizing the significance of studying deep geological layers with high precision. Earth Sciences Research Associate Bob Reynolds highlighted the rarity of such a find, noting that it provides a unique opportunity for the museum. Museum curator James Hagedorn expressed surprise at the discovery, comparing the odds to winning the lottery and getting struck by lightning on the same day. Reactions among experts vary, with some considering it scientifically unexciting, while others see it as a significant breakthrough. The museum plans to display the fossil as part of a temporary exhibit, showcasing its importance as a scientific and historical discovery for Denver. The James Webb Space Telescope has reached its 3rd anniversary since launch in July 2022, and it continues to deliver remarkable images of the universe. One of its recent highlights is stunning new images of the Cat's-Paw-Nebula, a star-forming region about 4,000 light-years away in the constellation Scorpius. These images demonstrate Webb's ability to reveal intricate details, including bright hydrogen emissions and direct imaging of exoplanets, which have expanded our understanding of celestial phenomena. Webb's international partnership, involving NASA, ESA, and the Canadian Space Agency, has made it the largest and most powerful space telescope ever launched. Since its deployment, Webb has contributed to discoveries of early galaxies, insights into exoplanets, and raised new questions about the universe's evolution. NASA's Sean Domagal-Goldman noted Webb's success in uncovering hidden aspects of the cosmos and inspiring future missions. Recent images include views of an Einstein ring, a protoplanetary disk, and the star cluster NGC 602, showcasing its diverse scientific capabilities. Webb's observations build on previous missions like Hubble and Spitzer, providing sharper resolution of star-forming regions such as the Cat's-Paw-Nebula, which spans 80 to 90 light-years. The images, released on July 10, 2025, feature narrated tours that encourage further exploration of the nebula's features. Using infrared light, Webb can penetrate dense clouds that obscure stellar nurseries, revealing the complex processes involved in star formation. Its observations show how massive stars reshape their environments by carving cavities in gas and dust, influencing future star formation. The Cat's-Paw-Nebula, named for its resemblance to a feline footprint with 3 toe beans and a wider heel, appears larger than the full moon from Earth and spans about 80 to 90 light-years. Webb's findings suggest that the activity of massive stars may eventually halt local star formation, as indicated by their luminous, short-lived nature. A new AI algorithm is promising to improve how doctors predict heart attack risks. Researchers from the University of Western Australia and Artria developed the CACDAD score, which analyzes individual plaques and their positions along arteries. Unlike traditional methods, this score reclassifies highly dense plaques as lower risk, especially near surgical procedures. It measures the overall burden of coronary calcification and the distance of each lesion from the artery's origin, leading to more accurate risk assessments. Professor Girish Dwivedi emphasized that precise risk stratification is vital for effective heart disease prevention, the leading cause of death in developed nations. Experts note that accurate scoring is crucial for personalized treatment, with calcium scoring being a key predictor for first-time heart attacks. Dr. Gavin Huangfu pointed out that current calcium scoring often misjudges the risk of calcified plaques near artery origins, sometimes labeling stable plaques as high risk. The new AI-based CACDAD algorithm aims to address these shortcomings and improve prediction accuracy. Once validated in larger international studies, it could become a widely used tool for patient management due to its simplicity and personalized approach. Traditional calcium scoring, like the Agatston score, measures calcified plaque but ignores plaque location and density. The CACDAD score enhances this by considering factors such as plaque density and dispersion, making risk predictions more precise. The study, published in Circulation Cardiovascular Imaging, highlights the limitations of traditional methods that overlook plaque location, underscoring the potential of this new technology. Atsena Therapeutics has developed ATSN-201, a gene therapy targeting X-linked retinoschisis, a genetic disorder affecting about 30,000 males in the US and EU. The therapy uses a novel AAV.SPR capsid designed for efficient targeting of photoreceptors and lateral spread within the retina. The FDA has approved expanding the Lighthouse trial into a combined Phase 1/2/3 study, supporting a potential biologics license application by early 2028, which could shorten market entry by at least 1.5 years. This trial expansion allows the study to serve as a pivotal trial, with early phase data showing positive safety and efficacy signals, including improvements in visual acuity and retinal structure. Recent data from May 2025 indicated that ATSN-201 was well tolerated and safe, with promising results in improving visual function. The therapy is delivered via subretinal injection and employs the AAV.SPR capsid, which facilitates lateral spread to photoreceptors and addresses the underlying mutation. Early clinical trials demonstrated a favorable safety profile and efficacy, with positive outcomes from Part A of the Lighthouse study. The expanded trial includes around 30 new patients, with enrollment starting in Q1 2026 and pivotal data expected in late 2027. Enrollment of pediatric patients in Part B is scheduled for fall 2025, with a Phase 3 cohort beginning early 2026 to assess measures like microperimetry, visual acuity, and macular structure. Atsena's pipeline also includes ATSN-101 for Leber congenital amaurosis type 1, which has completed Phase 1/2 trials and is moving toward pivotal studies. ATSN-201 has received multiple FDA designations, including RMAT, Fast Track Orphan Drug, and Rare Pediatric Disease, highlighting its potential as a first-in-class therapy. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. We'll be back Monday with everything you need to know.